When we talk about treating ADHD, we're really first talking about getting a good diagnosis. That is the most important aspect of what we call the front end of ADHD, understanding what's wrong. Before you even think about treatment, you want to understand, is there ADHD? And it's really a diagnosis that's made by thoroughly going through a clinical history, asking questions. We're doing a lot of neat studies right now to look at the brains of children and adults with ADHD, but we're not yet there to say that we're ready to just take a picture of the brain. It's not yet that time. We ask a lot of questions about how the child is performing. And then we need to ask a lot of questions about how the family is doing and how the child is doing in the school, the academics. We have to see, is there a learning problem? Is there other types of emotional problems that the child may have that may be causing this, or other issues? Once you've established the diagnosis of ADHD, then you talk about treatment. And when you talk about treatment, you're talking about understanding psychosocially what needs to happen. That is not using medicine, but just working with the parents and with the child. And then talking about using the medication. Once you've established a diagnosis, you really should start the treatment very quickly.
可唔可以徹底醫治嘅呢一個症狀？
It turns out that we don't see ADHD in terms of our current ability to cure it. We know, for example, that your son has about a 50-50 chance, half of the children from young kids up to his age will just lose the disorder as they grow older. They'll get better on their own. They just grow out of it. We know that children, as they grow older, will be less hyperactive. They'll be less impulsive, that is, acting before they think, making rash decisions. What we worry about is the attention, the focus, the organization. That tends to persist with time. Our medication treatments, which is usually what we're relying on now, largely using medications alone or medications plus other types of therapy, help reduce the symptoms. They bring them down, but only if you're taking them. So if you don't take the medicine, the symptoms come back. If you take the medicines, keeps the symptoms down. By keeping the symptoms down, the children do much, much better. They feel better. They do better in school. They do better with friends. A very important aspect of ADHD is their ability to connect socially. They do better in terms of how they think about themselves, self-esteem, how you feel about yourself, competency. Can I do something? That gets better with the medicine treatment. Some other important issues that medicine is involved in, it reduces the likelihood that your son or any kids out there who have ADHD will have an injury, falling, getting into a bicycle accident. It reduces when they're driving cars. It reduces in half the risk for a motor vehicle accident. It cuts back cigarette smoking and drug and alcohol problems, abuse or dependence or just problems with that.
So what you're saying is that there is some children with ADHD that will continue to develop what we call adult ADHD.
That's correct.
Is there really such a thing called adult ADHD? Because it seems that it is not, widely known. Can you make a comment on that?
Absolutely. It turns out that when you're talking about adults, recent studies in the United States that have looked at our entire population find that 4% of our adults in the United States have ADHD. About 50% of children will continue to have adult ADHD. We've also done genetic studies where we've drawn blood and done cheek swabs for DNA, and we find that they have ADHD. We've done pictures of the brain, and we've done very sophisticated types of scientific studies that you can only do in adults. You can't do it in children for ethical reasons, and it's very, very clear to us that there is a 4% rate of adults who have ADHD. It is definitely a disorder in adults. In fact, so much so now that our U.S. Food and Drug Administration, who is critical in the development of new drugs for ADHD in our country, requires that we do these studies in adults
Also.
with ADHD before we do it in children for ethical reasons.
Oh, all right.
So it's very clear, our government and the United States, that people, it is really unequivocal that ADHD exists in adults.